Great. I assume, Natasha, that I can begin.
Please, Dr. Roser.
Great,
Nice to see
great.
you.
Thank you. Fair enough. What a wonderful opportunity. Thank you so much, American College of Surgeons, for the opportunity for myself and other members of the Advisory Council for Oral and Maxillofacial Surgery, Doctors Brett Ferguson, Jennifer Warner, and Jonathan Shum. And if you're seeing all of our pictures, you can sort of see a spectrum of folks in various aspects of their career. Oral and maxillofacial surgery is a interesting subspecialty. Many of you that are listening will be in medical school with OMSs that are in 6-year track programs. We have 2 different tracks, and both will produce independent practitioners in the field. Maxillofacial surgery is an interesting area. A lot of people can't pronounce maxillofacial 5 times fast, so maybe we should change that. But it's essentially the area from below where the neurosurgeons to above the neck. And I'm the residency program director at Emory University School of Medicine. Work very closely with our plastic and ENT colleagues. But I'd like to take this time to turn over to Dr. Brett Ferguson, who's been president of our association and is chair of the program in Kansas City. Brett.
Thank you, Dr. Roser. Well, to tell you a little bit about oral and maxillofacial surgery, it is a specialty that is pretty big in Kansas City and certainly at the University of Missouri, Kansas City. Our residency got its start in 1946 in Kansas City. And of course, our residency, the oral and maxillofacial surgery specialty got its start in and around 1941. So as we have looked at the progression of our programs across the country, I'm happy to say, Steve, that you didn't know this, that there are over 100 programs now in oral and maxillofacial surgery. And in those 100 programs, 56 are 4-year programs and 44 are dual programs. And you know, the interesting thing about that is, what are our numbers? We have presently now about 1,230 residents in residency across the United States. And I tell you, our interaction with our surgery colleagues in plastic and reconstructive surgery, in otolaryngology, and certainly in general surgery, who give us our premise for our surgical profile, it is just amazing. And so when I look at the numbers of residents across the country, one of the things that I can say is it certainly appears to me that being one of the 14 specialties in the American College of Surgeons puts us on a very level playing field with our colleagues across the country. Thank you, Steve.
Great. Thank you so much, Brett. Dr. Warner has a special interest and is fellowship trained. Dr. Warner, can you tell the audience a little bit about your training and what you're doing now?
Thank you, Steve. So I actually went to dental school at the University of Florida. So I finished a 4-year program there. And then I matched at LSU Health Sciences Center in Shreveport, where I did a combined program, an MD and oral and maxillofacial surgery. That includes, at our programs, about 2 years of medical school, 6 months of anesthesia, 6 months of general surgery, and the remainder is all OMS. And then I did a fellowship in craniofacial and cleft surgery. After that, I kind of started heading up the cleft and craniofacial teams here in town and became the fellowship director. Then I was the program director for the residency training program for about 2 years. And then in 2019, I took on the role as the Associate Dean of Academic Affairs for our School of Medicine. So now I actually oversee all the curriculum for our medical school. So I work really closely with medical students. And we're going through an LCME site visit right now. So there's a lot of interaction with medical students for that time.
Thank you so much, Jen. Representing the Young Fellows Association, which is a really a fantastic a group of young and rising stars in all of the fields. Jonathan Shum, who's also specialized in an area. Jonathan, why don't you tell us a little bit about what your interests are, where you are, and what's your passion?
Sure. Thanks, Dr. Roser. Yeah, I am in University of Texas in Houston, in the Texas Medical Center. And, my training kind of starts with, dental school and doing oral and maxillofacial surgery residency program. It's an integrated medical degree program. And my interests kind of led me towards the management of pathology and reconstruction. And I pursued additional training through fellowship in head and neck oncology and microvascular reconstruction. And so in terms of my practice, the majority is management of defects of the head and neck, and also the management of benign and malignant pathology. So as you guys can, probably understand, there's a lot of overlap between ENT, oral surgery, and plastics. But in terms of where we enhance, the aspect, it's with, a solid background in the management of the oral cavity and being more mindful of occlusion and whatnot. But regardless, we're all, working hard to take care of patients for head and neck issues. And I do head the oral head and neck oncology and micro fellowship here at UT Houston in our faculty. My passions, I could throw in that I enjoy skiing, I enjoy tennis, but you guys probably don't want to hear about that.
No, on the contrary, thank you, Jonathan. I think these days it's work-life integration, and I think you're a great example of someone that's held that as a high standard. In closing, Natasha, I think that this forum represents the kind of collaboration that the American College of Surgeons really puts forth and holds a high standard to. Dr. Hussain, who you'll hear from shortly, and I are both the program liaisons from our advisory council, and I don't think there's been a clinical congress since we've done that we haven't co-sponsored and worked on panel presentations, and it's been a great collaboration everywhere from global surgery to sports injuries, and really I think represents what the House of Surgery stands for. So with that,
I could not agree more. It seems like such a collaborative group, and I think that's the beauty of doing this. It just really shows how many specialties work together. One of the big questions that always comes up is how did you get started? How did you want to do this? And what are kind of the paradigms of getting into oral maxillofacial surgery, and how would you advise the medical students on getting started?
I think I'd like Dr. Ferguson, Brett, to talk about that. He's been one of the senior leaders in our field, and still remains has a very large sphere of influence. So, Brett,
I'd be happy to. Well, certainly one of the things that we all have to consider when we're going into oral and maxillofacial surgery is that you're going to have to get that dental degree before you progress. And so that's one of the key characteristics that probably are different between plastic and maxillofacial and oral and maxillofacial. But I will say that not only do we as dentists then get into oral and maxillofacial surgery and then go into medical school, we also have the reverse, where individuals from medical school can enter into a program. They will have to get their dental degree while they're in the program, but then still be exposed to all of the different surgical modalities that any other 4 or 6 year candidate would get. I find that when my MD colleagues try to go over into oral and maxillofacial surgery, it still takes about 2 years, on occasion, sometimes 3 years. I, at the University of Missouri, Kansas City, have participated in training medical students to ultimately get their dental degree, but also have contacts at the University of Alabama, Birmingham, and as well as Louisville. So we have programs set up to where we have seen cross pollination, if you will, between both dental and medical school individuals. So thank you, Steve.
Great. Jen, would you like to make a couple of comments? You've come up in a similar manner, but somewhat different.
Well, I guess to kind of caveat and talk about how I got interested in the specialty, I actually was in college, and they didn't have pre-med majors then. Your biology and chemistry and math and physics and everything good. And then you kind of have to decide, do you want to go be a veterinarian? Do you want to be a doctor? Do you want to be a dentist? And I said I was going to go to dental school. And then when I got in the clinicals, what I really liked is oral surgery. So I decided I really wanted to have a dual degree. I really wanted to be in education. My family is all teachers and educators, and that's always kind of what I wanted to do. I'm really sorry. Speaking of work-life integration, my crew just got home. So my apologies. Since we're pandemic time, they're basically honorary members of every committee and webinar I do. So so I decided that I wanted to do surgery, and I matched into a dual degree program. And when I was in dental school, I was really fortunate to have exposure to cleft lip and palate teams and craniofacial surgery. And so I always had that interest in doing pediatrics since dental school. And so I kind of focused on matching into a program where I would have continued exposure. And then probably about during my 4th year out of 6 is when I really decided I wanted to pursue fellowship training.
Great. Thank you, Jen. Jonathan, how'd you get, what started you on your path?
My path. Well, I started with the desire to have a professional career. So I said, okay, well, I had friends who were in dental school, and they said, definitely check it out. And so I applied. I got in, and my background also includes the fact that my dad is a pathologist, and my brother at the time was a medical student. And so, I thought I would be happy pursuing dentistry, but similar to Dr. Warner, as you're going through it, you realized a passion. And so my passion and my drive was, I wanted to provide a different level of care, if that's a good way to say. So yeah, by all means, oral health is very important, but I just wanted to be able to do one step more. And so that led me to oral surgery. And, the oral surgery scope of practice is so broad that, sure, there are aspects of it that I didn't enjoy, but the one that drew my attention the most was the management of disease in terms of tumors and whatnot. And so through that interest, I went on to pursue fellowship and get that training and kind of fulfill that need or desire to help people in a certain way. And that's how I ended up where I am, doing the type of surgery that I'm doing.
There's a question in the chat, Brett, that did you know that you wanted to pursue this before you went to dental school? When was the aha moment? When was it?
Well, I'm kind of a different individual because I had a job straight out of college, and I was what they call a teratologist. So I had to get different animals pregnant. So I had to study reproductive physiology. After I got them pregnant, I exposed them to multiple drugs, and then did cesarean sections and cut the babies up from head to toe. So one of the areas of poisons that I was working with caused significant craniomaxillofacial deformities, in particular, anencephalics, cyclops, etc. And that is what really stimulated me wanting to go to dental school, but I didn't want to go to dental school to be a dentist. I wanted to go to dental school to be an oral and maxillofacial surgeon, because that was the first specialty that I saw that was able to repair those kids' faces.
Wow, that's I didn't know that about you. Thank you for sharing. That's really inspiring. I can say from just my own experience, my dad was a dentist, and I went to college wanting to practice with my dad. He was a general dentist, a really and good one, single practitioner, and unfortunately, he passed away. But if he hadn't passed away, I would not be here today. I would probably be retired. I'd have a large compound with many boats and a dock. But instead, I kept the dream. But about the second year in training, it occurred to me that we really were a specialty of surgery, and I needed to prepare myself for that. Jonathan, when was your aha moment?
In terms of pursuing oral surgery? Yeah, my aha moment was probably, in dental school, we learn about occlusion, which is teeth, and we learn how to wax teeth. And, in that same year, we also had anatomy. And so in terms of what my interests, what course I did better on and what made me say, oh, I want to read more, was definitely anatomy. And our professor at the time was able to correlate anatomy with clinical, applications. And so that was what caught my attention and made me feel that, okay, this aspect of dentistry is what I want to pursue. And that, I guess that would sum up my aha moment. My first time walking into the anatomy lab.
Great. Well, thank you. There's a question from Farah Amilabu in the questions and answers that you could either answer live. She wants to know a little bit more about what parts of OMS training did you like and what parts were not so much to your liking?
Yeah, no, I like, so, there are aspects of oral surgery, oral maxillofacial surgery, such as orthognathic surgery, let's say, and that's where you're managing and correcting skeletal deformities for people who are having difficulty with their, by chewing, speech, whatnot. I mean, definitely problems that affect daily living. I guess I wanted to see more drastic changes. So, big tumors, deformities, where that moment you remove that tumor, you're curing them, and you're reconstructing them. And so I like to see more dramatic changes. Although, having said that, orthognathic surgery definitely, yeah, I know, Dr. Warner, I'm sorry.
Dr. Shum, it's like a dagger to my heart.
No, well, this is where I'm going to say that, yeah, you will change lives regardless. It's just, I like the large tumors and being able to remove them.
I'm not going to tell my external distraction patient from last week about this.
By all means, no. I mean, it was just my interest, and yeah.
Great. We have a few more minutes, and there's another question from Jitesh Persaud, and I'm going to aim that at you, Jen. Do you believe OMS residency is efficiently structured? put on your medical education cap here. Why would dental students become less dexterous with 2 years away at medical school before starting surgical residencies? You know, what can be done? What's up with that?
So this is actually something that comes up in discussion all the time about within our own specialty. You know, what's the best track? Is it best for you to graduate from dental school and then do an internship year and then go do your medical school for some time? You know, or do you go directly from dental school directly to medical school while you're really in student mode? I think some of that will probably be dictated by our accrediting bodies, especially the Liaison Commission on Medical Education is looking to have standardization across OMS within medical school curriculum. So it may not be much of an option for us to decide anymore. We'll kind of see what the future holds for that. As far as dexterity, I think most of the programs try and work alongside the leadership of their medical school to make sure that the OMS residents are coming back on oral surgery. For instance, in our curriculum, we make sure that all the elective time, they're able to do that within our specialty in order to continue to keep up their hand skills. So I think there's ways around it. Do I think it's efficiently structured? I think we could always improve. We could always improve on how we educate and how we train. Simulation is a great way for us to keep people fresh in their skills. And I think that's something that our specialty needs to push more and more as time goes on.
Great, thank you, Jen. There's an anonymous attendee who put the question forth. What do you say to someone who's motivated to pursue OMS for an end goal of private practice, implants and extractions? I'd like to take that. And I'd just like to say the following. Every surgical specialty, in every surgical specialty, there's routine. There's routine stuff that you got to do. I'm sure, Dr. Carrick, you're a trauma surgeon, and not every patient in the trauma bay is, you know, the spectacular save, you know, and you know, we know that. So liking what is the routine in the specialty is really, really important. And I don't like private practice. I don't like I don't like the term private practice. Private, you know, means you sequester, you're isolated, you're introvert. That's not what this is. We train community practitioners, people who are obliged to take care of the community. I'm in an academic setting. I take care of the community that comes to me. My colleagues out in the Atlanta, great Metro Atlanta community, they take care of the people that come to them. And that's it. We both contribute equally. So there's really, you know, one's not a better citizen than the other. But I know all the programs that my colleagues are in. What they do is they make sure that when you leave, your obligation, aside from taking care of the people that come to you and doing it in a high quality way, you're a leader in the community. You're a leader in the community that you're in. The obligations of a leader are different and varied depending on where you are, but being a community leader. And if you look at our specialty and you look at trauma and you look at plastic and reconstructive surgery and any of the other specialties, the community leaders are, you know, the backbone of what we do and who we are. We're a piece of that. We just happen to have the opportunity to be able to train the next generation. So it's you know, if you want to be in the community practice, that's great. Just fulfill the obligations that the public expects of you. So
I think that was very nicely said. And I know we have a couple of more minutes, and I wanted to ask Dr. Roser and the colleagues any last minute advice, any any kind of pearls of wisdom that you want to share with the students?
Sure, I'll take the lead and I'll be really quick with this because I'd like to hear what my colleagues also say. As you look at the bottom end of training, or well, I should say the bottom end, the beginning of training, there are many opportunities for you. Learn it all, be a sponge if you can, but also think about an area that you have some questions, and ask those questions, and look deeply into those questions. And if you're going to medical school, look at oral health. That's a whole vast area, and a very interesting area, and could mean the difference for you in terms of your trajectory in whatever field you're in. Brett, would you make a comment or two?
I certainly can. I think one of the things that we need to think about when we start talking about the ability to collaborate between the specialties, I want to bring up one example, and I think everybody will get it. How about the facial transplant patient? That patient has to see the oral and maxillofacial surgeon for occlusion. He has to see certainly the plastic and reconstructive surgeon for some of the cosmetic enhancements. He's going to have to see probably even some general surgeons, et cetera, going on down the road. And certainly there are going to be some portions of the aesthetic and dental community who are going to have to help. So looking at the transplant patient is one way to say that the patient comes first, and whoever can deliver the best therapy, that's the one. And what I love for the medical students to consider is, aren't we tired of taking body parts to make a body part? Wouldn't it be nice to be able to grow that body part and you don't have to then mess up that patient's innate anatomy? So thanks, Steve.
Jen, you share some thoughts?
I'm so sorry. I was just responding to the chat. Can I finish that one real quick and I'll let Dr. Shum go?
Absolutely. Jonathan.
Dr. Rose, your question was closing comments. Was that it?
Yeah, it's just how would you sort of frame this up? You're talking to a very mixed audience, and well, what would be your parting thoughts for them in the area of oral and maxillofacial surgery?
Yeah, I guess having had a chance to work with students regularly, one thought is always the concern of time. It would be so much more time to pursue that, route, this specialty. But, during training, time flies. It's not kind of, bench work, or you're not in a classroom, you're learning on the job. And, I've met many MDs or medical graduates who are switching to oral and maxillofacial surgery. And it's the reason seems to be the combination of the lifestyle and the opportunity to practice a broad scope of surgery to help patients. And I guess to sum up, if you have that interest, definitely shadow, extern, do a clerkship. I would guarantee you any oral maxillofacial surgeon in your hospital, at your school, would be more than happy to have you shadow and see what it's all about. That's
Great.
Okay.
Thank you. And Jen, your closing
Yes.
comments.
I have the same advice, I think, whether I'm speaking with dental students or medical students. I think the biggest trick to all of this is finding something that you're passionate about, right? You don't want to look back in 10 years and say, gosh, I hate my job, right? Like, I'm not a person who ever wants to feel like I just want to punch a clock. And I think most people that go into these types of professions don't really feel like that. They came to medical school or dental school with passion. And when you leave here, you want to have that same passion for whatever route you choose. And so if oral and maxillofacial surgery is something you're really interested in, like Dr. Shum said, get with some local people, especially if you have them at your medical school or you have an affiliated dental school. And if you don't, you can feel free to reach out to any of us. I mean, we have all mentored many, many students, both medical and dental students, and are happy to advocate for you and figure out a path forward for you to pursue what you really want to do in life.